People with intellectual disabilities, autism, or anxiety disorders are often terrified of simple procedures. So to get them to cooperate or stay still, they are typically held down, restrained, or even sedated, which is very traumatic for them. So one Delaware mother came up with a better way. Mark Jastrzebski was born with Down syndrome as well as heart problems and had to undergo many operations and painful medical procedures in his childhood. His mother, Deborah Jastrzebski, says with each visit and bad experience, he got more scared.
And when he was 11, he needed to have allergy tests done, and it was a nightmare for him. My son was screaming and crying so hard blood vessels were bursting in his face. And as a mom, that just tore me apart. And I said, we won't do this to him anymore. I had to find another way.
Many parents of special needs children have horror stories of doctor's visits.
Even just to put an IV in his arm or draw blood is so frightening to him. And we have actually had 5 security guards have to hold him down at one time to get a needle into his arm.
There was nobody out there that we know of that would actually take the time to work with us or work with Lakita to get her past that fear.
With no alternatives available, Deborah Jastrzebski decided to create her own. She started to break down medical procedures into small steps and practiced with Mark.
He could hold his arm out. That wasn't too scary for him. He could sit in a chair. That wasn't too scary for him. Even when it came time to have the needle put in his arm, we simulated it with a paper clip. And he could do that, and then eventually he realized he could do it all put together.
Jastrzebski founded Practice Without Pressure, which today offers this kind of step-by-step practice to hundreds of patients who can also get actual procedures done in the offices. Dental hygienist Lauren Evans says observing the practice sessions is crucial for her work with patients.
We take the time that's necessary to really tune into the patient, find out what kind of makes them work, find out, do they have signs when they become uneasy. We learn a lot more about them during those practice sessions rather than trying to learn it in the chair, which is what you usually have when you work in a private practice.
Depending on a client's verbal skills, staff members use pictures and modeling to explain procedures, and patients always hold a stop card to be able to signal that they've had enough. For Stephen Cleary and his son Ryan, Practice Without Pressure has made a big difference. Ryan now goes to dental cleanings without any problems, which has lifted a huge burden off his dad's shoulders.
I no longer want to kill somebody when they're hurting my son. I'm no longer anxious to go. I'm going as a help guy. So it makes me feel a whole lot better, a lot calmer.
Staff member Karen Bashkow also has a son with special needs, so she understands the relief parents feel.
When people come into the center here, people sense immediately that they're welcome. If their child is the type of a child that needs to scream and yell when they initially come into a different place, they're allowed to do that. We have no problem with that.
And several parents told me they simply couldn't believe their eyes the first time their child completed a medical or dental procedure without tears, restraints, or sedation.
They must have been very happy about that and breathing a sigh of relief. Mike, and what about the costs for these services? Is it more expensive? Does insurance kick in a little bit here for people?
Right now, the way it is the actual medical and dental procedures are covered by insurance, but the practice sessions are not. So the parents typically foot the bill for that and cover that. They cost between $50 and $150, depending on what the child needs. And the founder of Practice Without Pressure, Deb Jastrzebski, told me that she is working with insurance companies right now to see if they will cover the practice sessions in the future, because financially it actually makes sense, because it's cheaper than to sedate a child, or it's cheaper than the long-term costs of families avoiding care because it's simply too stressful for them.
I would think it would fall under that column of prevention, right? Yes. And it could be looked at that way. Your story focused a lot on the medical and the dental services, but there are other areas that they're seeing some success with this, right?
Absolutely. They also, in these offices, they do women's health exams and they do haircuts for kids. And there's actually a lot that I think all parents can learn from how they approach these services, because many children are scared of the dentist the first time, are scared of getting their first haircut. So this approach of kind of easing them in, setting them down on the chair, showing them this is what we're going to do. If you're doing a haircut, these are the clippers, here's what they sound like, this is the dental chair. This could really avoid a lot of long-term problems for all parents. So,
and for kids of all levels and abilities as well, right?
Yes, absolutely.
Okay, thank you so much, Mike and Scott from the Behavioral Health Desk.